Hi, this is Chinny from Health and Lifestyles. Today we're going to talk about what hydration does to your blood work. 60% of our body weight is made up of water. Are you aware that every organ, tissue, cell in our body needs water to work? By drinking enough water, our body is able to eliminate our waste through sweating, urination, as well as through bowel movements. Are you aware that blood tests are an important diagnostic tool that we use in making clinical decisions in managing our patients? As such, it is very important to have a clear and concise instruction given to the patient before they do blood work. We need to make it clear to them what they need to do in order to prepare for blood work, as well as the do's and don'ts during the process of preparing for the blood work. Are you aware that when you are adequately hydrated, it's very easy for the phlebotomist to access your vein? It makes the venipuncture to be less stressful, less painful, and on the part of the phlebotomist, it makes it easier for them to do their work. Are you aware that if you're adequately hydrated, it makes the process of preparing the specimen when collected easier? Adequate hydration eliminates false positives that occur when the patient is dehydrated. So dehydration increases glucose utilization in the cell, thereby causing false low blood sugar. The compensatory mechanism, the liver increases glucose production, leading to uncalled increase in plasma concentration when you're not well hydrated. Also, false urine concentration can also occur as a result of inadequate hydration. False abnormal elevation of liver enzyme can occur as a result of hemoconcentration. False elevation of cholesterol, including total cholesterol, triglyceride, and HDL, the good cholesterol, and LDL, the bad cholesterol, can occur as a result of inadequate hydration, which means the blood cells are hemoconcentrated. Dehydration can also increase the blood urine nitrogen and creatinine, thereby causing a false alarm of impaired kidney function when the kidney function is actually not impaired. Also, it can also increase the glomerular filtration rates, which in short form we call GFR, and GFR is the best indicator of your kidney function. So when you're well hydrated, you get good results. Hemoconcentration, which is as a result of dehydration, not being well hydrated, can actually affect the result of your kidney. It can increase the GFR, giving you a false hope that your kidney is not impaired, even though the kidney is impaired. Inadequate hydration can also increase the blood urine nitrogen as well as the creatinine. Overhydration can dilute the blood. When the blood is diluted, you can get false impaired glomerular filtration rates, which means it is telling us your kidney power is not functioning as the way it should, even though it is. So what am I saying all this? Are you aware that in clinical practice, clinical decisions are made based on the result of these blood work? So it becomes imperative we, the providers, we provide clear, concise, straightforward direction for the patient as they prepare for their blood work. Inaccurate diagnosis leads to treatment failure as well as unnecessary expenditure. Inaccurate diagnosis can also lead to misdiagnosis. It takes toll on patient's life. It also has financial implications. It can lead to death. Clear and concise instruction need to be given to the patient at each encounter for blood work so that we are able to get accurate result, and that accurate result is going to be what we use to base our judgment in taking care of the patient. So it cannot be said enough. When you go to do your blood work, please make sure that you're fasting. If you're not fasting, let the phlebotomist know so that they can make a note that the blood was not done fasting. And sometimes most of the laboratory facilities will actually not proceed unless they clarify from the provider that it's okay to do the blood work even though you're not fasting. So depending on your health condition, if you're somebody who is diabetic, of course you don't want to go to do blood work by 12 p.m. fasting. You want to get to the lab draw center as early as possible so that you can get the blood work done and go home and eat, so that you do not go into episode of low blood sugar. Depending on your health condition, a primary care provider or your provider need to clarify how long you need to fast for, how much water you're allowed to drink. And based on all this, we will get a good, accurate picture of what your blood result is. And based on that, the provider is able to make accurate clinical decision. So this is it. Just want to get it out there what folks need to do when they are doing blood work, because every decision we make when taking care of the patient is based not only on physical symptoms and historical information we collect from the patient, but also on the result of the blood work. So if the blood work result is inaccurate, it means that we are making a decision based on inaccurate data. And that has not only financial implication, it also has life implication. It's actually a question of life and death in some cases. So this is it. If you have not subscribed to my channel, please do so. Like my channel and stay tuned. Keep checking our channel because you're going to learn more every week as we progress. Remain blessed and take care. Bye-bye.